speaking about is compliance, and that is the business sector in particular, the private sector. And we want to again appeal to the restaurants, bars, business places in general about the compliance. We have seen over the few months that wearing your mask, being compliant with the hygiene protocols are some of the non-pharmaceutical means in terms of us becoming more resilient towards this virus, which I have said over and over, we have to learn to live with. That's the reality. So we have to wear a mask, and the majority of individuals we are seeing either have the mask in their pockets, in their hands, under the chin, and sometimes even on the forehead. It's just one of the means for us to protect ourselves. We are discussing reopening the borders, and these are some of the things that we're going to have to do. Again, the social distancing, if you go by most business places right now, you will see that the markers themselves that they have at 6 feet, thereabout, the markers are worn out, and persons just refuse to reestablish the marking system. And we need these systems. These are some of the things that we just need in order for us to coexist with this virus. And these things are regulated. And if we see the police come to your establishment and becomes more aggressive with you, then we are going to say that the police or the compliance task force are somewhat, being too harsh or hard on you. And it's not that. We need to develop the behavior now. We need to change the culture. This requires a cultural change in us from the way we used to do things to how we need to do things going forward. It's very important. Hand washing, sanitizing. I think my hands have turned white from the sanitizing that I have been doing. And we continue. Once ago, in the beginning, you see everybody with a big bottle of sanitizer, all about everybody walking with their little spray bottle, hang on the waist, all about. But now, you can't even find somebody, walking with a little sanitizer. And these are some of the critical things that we're doing because we're using public transportations. We are holding doors. We are holding doorknobs. We are doing a number of things whereby the virus can be transmitted. And we are saying to the general public, if you want to assist us in this battle, you have to do a number of these things. So these are some of the non-pharmaceutical measures that we have to do. So besides that, we are here in the dialogue of economic activities. And what we have taken into consideration in consulting with a number of stakeholders is, like, for example, one, we looked at the return of the Ross University students. And I want to basically thank the university for their proactive approach. And, Mr. Ray Francis and Desiree McCoy and the team for the excellent work that they are doing. The system that we put in place and the protocols that we are putting in place together worked very well. He allowed us to test our systems. He allowed us to do a number of things so that we can prepare our frontline workers, our infrastructure in getting ready for the opening where we're going to have mass influx of persons coming into the country like before. Now, they have proposed that there will be a schedule of return of students and faculty. Now, remember those students that arrive, they will be leaving at the end of August. But thereafter, there will be another group of students that will be arriving in the country in the first week of September. Now, I am preparing you. Again, let me repeat, there's an estimated date for the arrival of another group of students from the United States. They're going to go through a more vigorous system because we have seen what is happening in the US in order for us to be able to filter any potential COVID-19 positive case. So we are confident that the system that was used before is actually a good system to use again. Now, we're talking about repatriation, and persons keep asking, well, what about holders of work permit? What about visitors? What about residents? Now, At the present moment, in order for us to expand this, we are looking at nationals and residents. And we have started discussion, listen to me carefully. We have started discussions on holders of work permits and visitors, and 3 visitors who wishes to stay for more than 14 days. Because as of now, as we have been doing, the visitors, we are not stepping down we are not stepping down from the 14 days quarantine for now. That is set in stones for now. It's a work in progress, and until the science advises otherwise, and the cabinet decides to take the risk of having, the risk of a compromise of anything below 14 days, it will remain at 14 days. So anybody desirous of entering to St. Kitts and Nevis, come with this in mind. You will be quarantined for 14 days. Now, the reopening of the borders. So there's a lot of discussion on reopening the borders. So what will this require? So let me just basically share with you some of the things that we are doing collectively with a number of stakeholders. So we looked at something to do traceability, at the same time market St. Kitts and Nevis, and also help us in the fight with COVID-19. And in that, we have had a proposal from a son of the soil in having a app developed for St. Kitts and Nevis free of cost to the government. And in this app, we are going to be able to manage while being able to also trace persons who will have to go in quarantine. The reality is that we are not going to be able to always pay for someone to be in quarantine or sustain persons to be in one particular location like we have now, where we have the OTI facility. We're going to have to open up our quarantine facilities. What that means, probably we're going to set a criteria going forward where persons can become, where facilities such as guest house, villas, private villas can actually become quarantine facilities with security and everything else. Again, we are looking at economic activities. So I'm going to appeal to these security firms to get yourself organized so that when the time comes and you're engaged, you can provide this service in a safe manner. So therefore, let's say a millionaire like Dr. Wilkinson want to come to St. Kitts and Nevis. He has a condo in the southeast region. We verify that he has this condo. He meets the criteria where he's able to pay for his own security. He understands that he cannot move. He will need to have someone to bring the supplies to his home until that 14-day period is over. He will be subjected to having the app downloaded on his phone. He's going to subjected to having the police patrol now and again, pay him a visit now and again. Not that they're going to see him physically, but at least they will pass by the home. And also ensure that he has private security accredited by the task force and by extension the government to monitor the movements 24/7 right at the property. Once you are able to meet those criteria, then you are able to quarantine in your villa. No, quarantining in your villa doesn't mean that it gives you a passport to go all over the place. That's not going to be so. Because the only passport that will give you, if you break the regulation, is straight to a cell. That's the only passport you will get if you don't comply with the regulation. So these are some of the possibilities that we are exploring in order to make us viable. And that's the true reality, because we are not going to be able to quarantine persons the way we are for a long period of time. I'm speaking about long term. So if that comes to bear, I think it will create more economic opportunities for individuals, and also we may attract also other investors. So we have the app, and the app is almost 90 to 95% completed. We're going to do some more consultation, and after doing some more consultation, then we're going to have the official launch of this app. So then, besides the app, what else are we going to use in opening our borders? Let's look at some of the equipment that we're going to be needing. Now, you arrive into St. Kitts and Nevis. You have to come off of the aircraft, enter into the buildings. But before you enter into the building and engage with our border agencies, such as Immigration and Customs, we are saying, listen, you engage technology. What's the technology? Touchless kiosk. So you walk up to the touchless kiosk, the kiosk will screen you. That's the first set of, that's the first process. So the kiosk will screen you. As the kiosk screens you, it gathers all the information necessary for all the frontline agencies that needs to have that information, in particular the health, port health and health. Now, after you are screened by this high-end technology, and the reason why we need to use high-end technology is because we have to remain competitive in the market. We want to give visitors and citizens and residents alike the best experience in entering into St. Kitts and Nevis under the COVID-19 new norm. So the technology takes all this information from you, so you finish with the screening. From the screening, you will then move over to the medical testing booth. Next slide, please. Medical testing booth. So this is a negative pressure testing booth, whereby we are protecting the healthcare worker and also the passenger entering St. Kitts and Nevis. So therefore, as you can see on your screen, there will be little to no contact between the passenger and the healthcare worker. So the healthcare worker will enter his hands through, his or her hands, through the gloves, as is right there, take the sample, and after they take the sample, then the sample will be processed further. So you go one, screening using the technology, where all your medical information, your temperature is taken. Secondly, you move right there to the medical testing booth. After you go to the medical testing booth, then we will have cameras actually picking up temperatures as well, so that if we miss you one way, we're going to pick you up the other way. And what will happen if you have a high temperature, if you go back one slide, please. If you have a high temperature, the camera then will register an alarm, it will take a picture, and that image will be stored for tracking. So using that image, you will be tracked. What that will do, it would assist the port health officers in terms of monitoring persons with potential symptoms. Now, that is just the infrastructure that is needed at the airport. We need more than that. We need transportation to complement all of what I have just said. So what we are trying to do through the Ministry of Tourism is to have COVID-19 certified taxi operators. And as you can see in the image, what does this require of you, taxi operators, or even public transport? One, hopefully that you can create a barrier between you and the persons you will be transporting. Two, you should have sanitizing stations within your vehicles so that as persons entering, they can sanitize their hands. Three, ensure that you wear a mask and persons entering into your vehicle will be wearing masks. And if necessary, the driver should be wearing gloves when handling money or even handling the suitcases, ensuring that they change these gloves ever so often. And finally, we have to become innovative. And you heard the Honorable Prime Minister saying that on his show the other night. We have to become innovative. Our taxi operators are going to have to enhance their payment system by possibly going to e-payment, whereby nobody has to touch. It's just somebody swiping the cards and basically making the payments. And these are some of the things that we are asking our stakeholders within the tourism sector to be able to become innovative and create economical opportunities. For example, as I stated today, one of the things that we are challenged with is transportation for persons coming for repatriation. So if we have taxi operators who are certified, they can actually move these passengers that come in, or nationals that come in, from point A to point B, meaning from the airport to the quarantine facilities at a cost to them. And this is critical. This will generate economic activities. So if we know we have operators A, B, C, and D who are certified, we can put you into a rotational process whereby as we have flights come in, we can actually call upon you in a very orderly manner to transport these incoming passengers from the airport to the quarantine facility at a cost to the incoming passenger. So therefore, the taxi operators would be generating income. And this is where we want to go as we continue to create economic opportunities. What is happening right now? The Tourism Authority is continuing to carry out capacity building programs, meaning training. We have to prepare the general public, the workers at the airport, at the hotels, for them to be able to perform under this new norm. What does this mean? Considering room service, looking at the persons who are going to be doing laundry, the cleaning process, sanitization process, and looking at a number of things that are going to be required for visitors to stay in hotels and guest houses and villas, because it's not going to be the new norm. You can actually create cleaning services that provide professional cleaning services. That is something that is going to be necessary. What about laundry? Persons staying in these places is not the same old norm of doing things. It's a new norm of doing things. So a number of economic opportunities can be created from this situation. So I want to appeal to the general public to become innovative in ways in which you can actually become economically active in terms of fighting this COVID-19 disease and adapting to the new norm. It's going to require the citizens and residents to change the cultural norm of operations in St. Kitts and Nevis. Now, as we move to the hurricane preparedness tip, the beautiful thing about it is that the Atlantic right now is very quiet. It's harmonious. There is no apparent threat right now to the Caribbean chain of islands. So therefore, please continue to prepare. Look at your plan, revise your plan, and if you don't have a plan, create a plan. Use the opportunity that we had the other day to validate where you're at in terms of preparedness so that you can respond. I must commend, before I end, the general public and to some extent the private sector for their response the other day when we had the system passing nearby. As you realize, as soon as it passed the Caribbean, well, let me say the Leeward Islands, it turned into a hurricane, which is Hurricane Isaac. That in itself shows you the dynamism of weather, and therefore we must not take, so Isaias, sorry, I said Isaac, unless Roy Williams is correcting me. It's Isaias, okay? So, Isaiah, right, sorry, let's why thank you very much. Hurricane Isaiah that reached category 1. So thank you very much for listening, and we do look forward for your questions and engagement. Thank you. Sorry, let's why before you come, I just want to acknowledge this group of persons that was brought to my attention. It says here, with your permission, let me read, please. Dear Mr. Samuel, first of all, let me congratulate the National Emergency Operations Center and the efficient way in which you set out the plan in St. Kitts and Nevis for the fight and prevention of COVID-19. And I must also, also acknowledge the Health Emergency Operations Center, which is the HEOC. The St. Kitts Home Economics Association is pleased today to hand over this check in the amount of 5,000 Eastern Caribbean dollars. This association wish is that this donation help in the purchasing of personal protection equipment, PPE, for all persons who have to be on the front line in the event there is a case of COVID-19. I guess what was meant a positive case of COVID-19. We, the members of St. Kitts Home Economics Association and the retired home economics teachers are very concerned about this virus, and we feel very proud to be a part of the fight and prevention. Yours sincerely, the St. Kitts Home Economics Association, It was signed by Eileen Woods, Patricia Rogers, and Delia John. So thank you very much to the St. Kitts Home Economic Association for their contribution.
Thank you very much, NDC. Maybe because I'm so much in the news and always getting the breaking news, I am aware that the Atlantic hurricane season, that the forecast has been raised to 24 storms, the second most on record, and that 10 of those storms are forecast to become hurricanes. And so. But we come to the question and answer segment of our press conference, and I do have a few questions already. The first one, why do we still have a curfew at midnight? I can catch the virus if it's out there before midnight. Dr. Laws.
That's a very good question. And yes, you can catch the virus if it's out there at 11:30 or 11:45 p.m. And so my task is to explain why do we have the curfew. Now, the non-pharmaceutical measures that have proven to contain the COVID-19 outbreak include the wearing of the face mask, hand hygiene. The hand hygiene is one of the best measures to fight this virus. Appropriate sanitization, meaning cleaning those commonly high-touch surfaces. Physical distancing, maintaining a distance of 3 to 6 feet away from those around you when in public spaces. And social distancing, avoiding crowds of persons. Yes, so these are the non-pharmaceutical measures that have proven to contain the virus. Now, the COVID-19 task force notes that compliance, when you drive around St. Kitts and Nevis, at present, the compliance with these measures have reduced, and this is regrettable. Yes? Now, the Emergency Powers Regulation, Section 2, I think, states that at present, the curfew starts at midnight and it goes down to 4:59 a.m. each day. Now, the curfew helps to enforce physical distancing and social distancing. Because come midnight or before, because you're advised to start heading home, giving yourself enough time to get there by midnight. And so the curfew helps to enforce the physical distancing and the social distancing measure. Yes? And so ultimately, the curfew helps to reduce the transmission of the virus. So, let us say I'm on the strip and I'm exposed to somebody who inadvertently has, somebody who has this virus, and I may have contracted it. If I am allowed to stay on the strip until 1, 2, 3, 4, 5 a.m., the risk of my transmitting or passing on the virus to others who I'm interacting with is increased. However, if I head home by midnight, just the fact that I'm home, that reduces the risk of my transmitting the virus to a big number of persons. So yes, you can catch the virus at 11:30 p.m., but the curfew helps us to reduce the transmission of the virus to a large number of persons.
Thank you, Dr. Laws. The second question, what is meant when the doctors say opening the borders come with a risk, and what level of risk will we take to open our borders? Dr. Wilkinson will take that one.
Thank you, Leslie. When you walk around town, one of the questions we get asked commonly is, when are the borders going to be open? When are the borders going to be open? And persons tend to ask that question as if it's just a matter of going back to the normal and we are going to be having the regular flights flying in here every week from the UK and from Miami, etc. Now, any attempt to open the border would come with a risk of the importation of the virus. And when we speak about the risk involved in opening the borders, we are speaking about the risk of reimportation of the virus. Right now, we have 16 cases that are recovered, and we have one that is recovering. And after this case recovers, if we had not had any spread within the community, we would get to a point where we would go a few incubation periods and we might be COVID-free again. Now, if we were to aim for zero risk, which means that we don't want to have the virus in our country at all, it would mean keeping the borders closed completely until there is a vaccine, which would not be for another several months or another year. And that is neither desirable or realistic, in that we have to have some degree of economic activity. Therefore, we would have to open our borders, but we have to open it carefully, because what we don't want is to open our borders and we see what's happening in some countries where their health system becomes overburdened and then we have to close again. And that is what we mean when we speak about the level of risk. And so if we are to advise the government, of course, we would not be reckless in opening the borders to a place like Miami and having flights coming in here, because the risk of the importation of the virus right now would be very high. We would not have our ports open and having cruise ships with thousands of persons coming off, because the risk of importation of the virus then would be pretty high. And so what we're going to be doing is doing it in a responsible way, where if someone is going to come, they would have to be quarantined for 14 days, as Mr. Samuel says, because that is the protocol that carries the least amount of risk. And after the 14 days, once they're tested negative, they would be released. I just want to add on another point about what Mr. Samuels mentioned, because he spoke about having a villa in Frigate Bay. But one can have a pre-approved place in Sandy Point or St. Paul's or Keon, and so it doesn't necessarily have to be the Dr. Williams he spoke about, who is a millionaire living in Frigate Bay. It could be Dr. Williams, who is going to Sandy Point or Keon or Diet Bay. And in terms of the curfew, I just want to say also too, sometimes we have to protect people against themselves. The same way, if I use an analogy, Juve morning, we normally close down at midday, because the longer persons go on after that, after they were partying all night, they drop their guard and they start to get into trouble. After midnight, if you were to go on the strip, 12, 1, 2 o'clock, you will see persons there more inebriated, and in that way they would drop their guard in terms of their compliance towards using a mass social distancing, etc. And so it's important for us to have these measures in place. And I'm sure Cromwell Henry, he is here also. It puts extra strain on the security forces having to be guarding the strip down until 4 or 5 o'clock. And so I see people complaining about the curfew on social media and wondering, well, why, what is the sense in having it? There is some method to the madness, and I am happy that we still have the curfew in place, because it helps to keep the virus under control.
Somebody is asking here if the curfew will be extended to 2 o'clock in the morning, because there was a statement that was made by the Honorable Prime Minister at a church setting of the curfew being extended to 2 a.m. to give people some time for more social activity. Mr. Samuel.
Mr. Williams, thanks for the question. And there are consultations that are ongoing in terms of the easing of the restrictions. We have looked at several recommendations that have been made to the task force. And the task force will be having some discussions with the mitigation council ministers in terms of how do we go forward, ensuring that there's a balance between the health and also the social life in St. Kitts and Nevis. Thank you.
This next question, can you tell us more about the pre-approved quarantine sites, Dr. Laws?
Another good question, Mr. Williams. But before we talk about the pre-approved quarantine sites, I want to confirm and underscore that at present, nationals are being repatriated, and they have, once you land in St. Kitts, you automatically go into quarantine. Official site is the Ocean Terrace Inn. So that's the protocol that is established, and that's what we are following at present. And so the COVID-19 task force is now tasked with developing and establishing a new protocol whereby we will be considering other sites, state-approved quarantine sites. Now, such sites can be located anywhere, as Dr. Wilkinson just mentioned, rural or in the capital. Now, some of the requirements would be individuals should be able to stay at such a site whereby they can carry out activities of daily living independently and safely. For example, a single bedroom and have its own bathroom whereby you can live comfortably for the duration of the quarantine period without much exposure to other individuals. You must have appropriate cooking or food preparation facilities and laundry facilities. In other words, individuals who would be staying at these pre-approved sites should be able to carry out activities of daily living safely and independently. So the requirements would cover this. Now, one other important aspect of this state-approved quarantine site, there is going to have to be a pre-approved security facility. This will be a requirement for the use of, for your choosing such an option. And so individuals who choose this option must cover the cost, the full cost for staying at this pre-approved site, and they would have to cover the cost for security. And this security facility would be pre-approved also.
Thank you very much, Dr. Laws. COVID is really creating some costs, some real costs. This question is from Vaughan Radio, a Shemika Bujin for Superintendent Henry. Why are we not seeing the police on the road executing their duties when it comes to the current curfew that is put in place, which is 12 a.m.? Persons are still seen on the road 1 or 2 o'clock in the morning, especially on the weekends. Can you shed some light on this?
Thank you for that question. I would not readily agree to that statement that the police are not out enforcing the curfew. The police, in fact, are. In fact, several persons were arrested in recent times. I have not announced those numbers, but persons have been arrested in recent times. But what we have to understand is that the regulations made provisions for persons to be exempted. The commissioner would grant exemptions to some persons for reasons once he is satisfied with the reasons. Additionally, essential workers are also exempted. The security guards, the hospital workers, those category of persons are also exempted. So you would see persons on the road. It doesn't mean that everyone who you see on the road is in fact breaking the curfew. So again, the police are in fact out enforcing the curfew, and persons who you may see on the road, I'm certain most of them are persons who are exempted. Thank you.
Thank you, Superintendent. This next question is also from Vaughan Radio, from a Daniel Moore for Dr. Laws. Given the expectancy of a second wave of the coronavirus, will there be any free or reduced cost in the price of testing for the general public when the Federation's borders gradually reopen?
At present, we have a local private laboratory, next generation laboratory, that offers the COVID-19 molecular test, and there is an attendant cost to that. Now, I must inform the general public that the JNF General Hospital just acquired a molecular machine from the International Atomic Energy Agency. And so we are in the process of setting that up at the JNF General Hospital's laboratory. And so when that becomes functional, we would then determine the cost of the molecular test in the public sector. And, when, that cost will be announced. Probably it will be less than the present rate. More than likely it will be less than the present rate, but we'll see as time goes along.
This question is also from a Vaughan Radio, from a Shamika Budgeon, but it seems sort of self-explanatory. But I will read it. Persons that are currently repatriated and are in quarantine, what countries are they traveling from, and are they returning from any known hotspots? The very fact, Dr. Laws.
Based on my knowledge of the countries of origin, most of them are coming in from the United States of America, which is a hotspot. Some are from within the Caribbean region. We had one or two from Canada. I think we had one or two from Europe, meaning nationals coming in from these countries. Thanks.
This next question, when will phase 3, and this is our last question for today, when will phase 3 of the COVID-19 protocols be rolled out as it relates to sporting events, in particular football, so that the St. Kitts Nevis Football Association can resume its football leagues, with or without fans? Dr. Laws.
Okay, so at present, in the present iteration of the emergency powers regulations, the various sporting disciplines are allowed to operate under levels 1 and 2, which is really practice and training sessions. And so there is some discussion taking place within the COVID-19 task force with respect to what will be allowed in the next iteration of the emergency powers regulations. And frankly, what we are thinking is we want to allow practice matches within teams and between teams and clubs, but spectator-less practice matches for at least the next iteration of the emergency powers regulation, such that the various team members can be au fait and be well informed as to the new measures going forward. And that is the new measures and protocols within each sporting discipline. So you mentioned football, and so in other words, each of the clubs and the teams need to be, au fait with the protocols coming from FIFA. Thank you.
Thank you very much, Dr. Laws, for answering those questions. Of course, we try our best here at the National Emergency Operations Center, COVID-19 briefings, to answer your questions as best as we could here at the NEOC. If you have any follow-up to a question, you are free to ask that question at our next briefing. So I want to thank Dr. Laws and to thank Dr. Wilkinson, to thank Mr. Samuel, and to thank Superintendent Henry for always being here and doing their best to answer the questions that you have. This brings us to the end of our National Emergency Center COVID-19 briefing for today, August 5th, 2020. I thank Mrs. Christmas Jacobs for providing the service of sign language, Vesta Southwell for her continued collaboration with the NEOC in terms of communications, ZIZ and all the media houses within the Federation who continue to work with us in terms of providing accurate and official information with respect to the management of the pandemic here in St. Kitts and Nevis. Dr. Laws and our Chief Medical Officer, Dr. Wilkinson, Medical Chief of Staff at the Joseph N. France General Hospital, and Mr. Abdia Samuel, the Chair of the National COVID-19 Task Force. Of course, it is not easy, the work that they are doing, and it must not go unrecognized. They are working very hard to ensure that we remain healthy, that we remain safe here in St. Kitts and Nevis. This is a global fight, but more so, it is a fight at the national level, recognizing that no man is an island. We are not alone. We are part of the world, and what is happening in the world affects us here. And what affects us here affects other people in other parts of the world. So thank you very much, all our listeners, to today's briefing. Continue to tune in for information and continue to keep all the protocols which have been put in place to keep you safe and healthy. We will be back on Wednesday of next week with another COVID-19 briefing. Until then, take care. I am Les Roy Williams.